from a business perspective, why, if you buy a laser, how are you going to make money from the laser? What's the ROI? We refer to that as a return on investment. I think return on investment's misunderstood. I think doctors, when they buy a piece of equipment like a Biolase laser, are concerned about, how do I charge for it? In my office, I actually don't charge for it. There's no extra charge for using a laser. Where I pick up the financial improvement is doing procedures that I would never have done without the laser. So procedures, what procedures do I do that I wouldn't have done before? Biopsies, soft tissue biopsies, mucoosseous surgery, periodontal surgery, they call it repair surgery. Phenomenal result with the Biolase laser. Fillings with no anesthetic, so we increase our time. Frenectomies, we do maybe 1 or 2 frenectomies every week. Pocket reductions with the laser, hygienists do that. We have certified hygienists that use a Biolase laser to reduce pockets, disinfect gingival tissues. So all these procedures, they have a charge. Not more than I would normally charge, but they have a charge I would have never done in the past. It's just a huge benefit. And so I find that when I first got the laser, I was wondering how I would pay for the loan, pay for the lease. And within weeks, it became very obvious that this was a phenomenal tool and that it would easily pay for itself, which it did. When you use the laser, one of the advantages is time. There's a discussion that the laser is slower than a drill. In some cases, that's true. But the advantage is when you do multiple procedures, you save time. It even I can go so far as to say you save appointments. You can do, let me give an example. You do a filling, a very deep filling, and you think, oh, I'm too close to the bone. I have to send it to the periodontist. They have to do a crown lengthening, an osseous crown lengthening, and I'll put a temporary filling in there. That's not what happens in my practice. In my practice, we save that patient the appointment to go to the periodontist. We save the appointment after to do another filling, because at that appointment, I simply do the osseous crown lengthening with the Biolase laser, and then I do the filling in about an hour and a half, maybe an hour. So we don't charge as much. We don't take extra appointments. For the patient, it's a monstrous time saving.